You're watching Let's Chat.
It's so good to have with me on the show today, Summit Physical Therapy. And today we are talking about TMD and peripheral neuropathy. Thank you so much for coming on the show. Physical therapist Nick Colbert and owner Kevin Costa. Good to see you.
Hey, good to see you.
So let's start with peripheral neuropathy. That's a big word.
Yeah, peripheral neuropathy is neuro meaning nerve and pathy meaning disease. And so it's a disease process or an injury to a peripheral nerve throughout your body, particularly like in the lower extremities, and it can happen in the upper extremities as well.
How do you treat this? And maybe how does someone know they're suffering from it?
So some of the causes can be diabetes. That's the largest cause of peripheral neuropathy, followed by like chemotherapies, some drugs like statins or antibiotics. Some can be to chronic infections or a trauma to a nerve itself. But 25% of it also can be idiopathic or unknown. And so the treatments would be doing an examination and an evaluation of someone that would come in. So we'd establish a plan of care for them and thoroughly assess them for touch sensitivity or loss of sensation. We'd check their strength, we'd check their balance, proprioception, and so forth, because those are the things that get greatly impacted. And so people with peripheral neuropathy tend to be really high risk for falls and further injury.
Is this common?
It is common, unfortunately. There's about 40 million people that suffer from peripheral neuropathy.
Kevin, why did you decide to offer this treatment in your clinics?
Well, Nick spoke to it. There's a big population of these people that are suffering, and there hasn't really been a good or effective treatment out there until we started bringing in like our anodyne treatments, our light therapy treatments, and also combining that with the other skills that we utilize for balance, for flexibility, for the nerve glides. So there's just that big population that needed a good regimen to be able to help that. And it's just not really out there. And so people with peripheral neuropathy just don't know that there's a treatment out there for them.
Well, let's talk about TMD. That was a very big word, so I'm glad we're using the initials. And TMJ pain, what is it and who suffers from it?
Yeah, so anybody can suffer from it. Particularly, it's higher concentration in women than men. But TMD pain is when the joint itself in the jaw becomes dysfunctional and has pain. And so it's no longer working appropriately. So it can affect things like chewing, yawning, sleeping on your side or anything like that. It causes great pain. So you have limitation in your ability to actually move your jaw.
And what are you seeing causes that? We were talking about maybe stress.
Yeah, so stress can be a big factor.
Right.
Stress with grinding or bruxism of your teeth. Other factors that can cause it are working positions and postural positions. So people that tend to work at a desk or positions where their head is always forward tend to struggle with TMD issues. So there's also a cervical component that goes with that. So you usually would treat neck and the jaw at the same time.
Now, in terms of treatment, I've had very successful dry needling here for my lower back, and I was interested to learn you can treat jaw pain with dry needling.
So I like to utilize needles to help reduce muscle tone or spasms within the masseters and the temporalis muscles. I have a little bit longer needle that I utilize to get the pterygoids, which are deeper in, which is really kind of hard to get to with your fingers when you do an internal mobilization.
Right.
And then I like to use electrical stimulation to help downregulate the nervous system and reduce inflammation and reduce pain.
Dry needling is so interesting, the science behind that and how it treats pain. So talk to me, Kevin, about how we can get a hold of you, maybe make an appointment.
Sure. You can reach out to us on the web. Go to our website, Summit, SUMMIT, therapy.com, or you can call us at 423-777-4974. We have 7 locations all across the Chattanooga area that are conveniently located. Scheduling is easy.
I can speak as a former patient to your thoroughness and education and compassion. So thank you both for coming on the show today.
Thank you very much.
Nick and Kevin, summit-therapy.com to learn more about treatment of your peripheral neuropathy, TMD, TMJ pain, and all the other services they offer. Thank you again for coming on the show.